Heard It Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Heard It Health. I'm Marissa Plesha, reporter for MedCity News. I'm here with Preeti Shah, Chief Product and Technology Officer at Iodine Software, a company that sells technology to improve clinical documentation, coding accuracy, and revenue cycle management. Thank you so much for joining us.
Thank you for having me.
So AI is a really hot topic right now in healthcare. How do you see that affecting clinicians right now, and where does your new partnership with OpenAI come in?
Absolutely. So let me start off by saying Iodine's been sort of a pioneer and a trailblazer in the AI space. We've not really viewed Iodine as using AI as an enabling technology, but really focused on the core and the value of that we provide to our customers on a day-to-day basis is fueled by AI, and to that end, we're fully committed to kind of keeping up. From our vantage point, we sort of view AI as having tremendous potential in really optimizing healthcare operations, specifically from an administrative standpoint. But I think it's important to note that not all AI is the same, right? There are a lot of AI companies offering up AI solutions, but that are really rules-based and they're not as effective. In contrast, Iodine has always harnessed and leveraged neural networks, natural language processing, and most importantly, our powerful cognitive ML engine, which really emulates clinical thinking. And we've really focused that to really optimize and help providers out in the areas of clinical documentation integrity, medical necessity, and utilization management. As the world of AI tech gets really exciting with the onset of Gen AI and the LLMs, we've really expanded our partnership with OpenAI, and we are leveraging GPT in our products as we speak so that it can continue to have more value to our provider customers and our hospital systems. I think it's also important right now to note our partnership with OpenAI is just a natural progression of our commitment to innovation. We view innovation in multiple facets. We have our own internal innovation labs, and then we're also absolutely partnering with big cutting-edge companies like OpenAI to kind of foster functionality in our products that can continue to add value to our provider customers. I think it's important also to note that from our vantage point, we've always been true to the fact that any product that we bring out to the market has always been to really empower our sophisticated clinical end user. We've all throughout our journey really sort of bubbled up those needles in the haystacks that allow our sophisticated clinical end users to make the right decisions at the right point of time. We recognize that we're in the clinical area, so we absolutely want to emphasize that human in the loop. Our products are there to support them, not to replace them. Last but not the least, when I think about Gen AI and I think about the power of the LLMs, the power of these LLMs is only limited by the amount of data we feed it. And I think this is another area where I think Iodine has an advantage. We currently have about northwards of 40 million inpatient records that really turbo boost our models in terms of accuracy and prediction. And we hope to bring that to bear even as we harness the power of the LLMs in our products.
That's great. Thank you for sharing that. Another big area for health systems is revenue cycle management. What are the opportunities in improving that area with AI?
So when you think about revenue cycle management, the larger macro environment over the past couple of years has been pretty bleak. Hospital systems are under intense pressure of shrinking margins, physician burnouts, and just overall labor shortages. This is where, again, I think products from Iodine, such as our clinical documentation, Aware CDI suite, and our utilization management, Aware suite, can really come in and help to really scale the operations of the clinical work teams. It allows clinicians to then work at their own licensor and actually showcase opportunities where basically bottom line improvements can take place. Our cognitive ML engine essentially takes in raw clinical data and really synthesizes that data and surfaces up those opportunities where clinicians can make crucial, critical clinical decisions at their fingertip and thereby impact reimbursements as well as quality.
Yeah. What other areas of healthcare do you feel like there's room for innovation, and how is Iodine supporting this?
Yeah, so I think Iodine's really been a flagship provider in the world of clinical documentation integrity. And it's an interesting area because I think it's the least talked about, but probably the most important part of the middle revenue cycle management of a hospital system. We all know clinicians are incredibly busy providing support and taking care of patients as they should be, but they're also under intense pressure to constantly keep their documentation for those patients up to date in the EHR records. A lot of times what that leads to is missed conditions listed in the clinical documentation or missed diagnosis listed in the EHR. And this is where technology from Iodine can come in, because every misdiagnosis ultimately results in it not being coded and reduced reimbursements to healthcare systems. And so this is where technology like Iodine comes in. We basically crunch all the clinical data. We run it past our cognitive ML models, and we surface up those areas where we are seeing the most amount of discrepancy between what's listed in the patient record versus what we are seeing in the clinical conditions. And we'll serve those up to the clinical documentation integrity nurses in the order of priority. They can then actually review it, so the human in the loop, send a query out to the physician to get it updated, and once they agree, the documentation gets updated in the patient record, which ultimately leads to two things. First and foremost, now you have a complete patient record that reflects the right condition of the patient. And secondly, it also ensures the provider system gets paid accurately for the services that they provided. We've been incredibly successful with it. We've, over the course of the past few years, also made a couple of acquisitions. As a part of that acquisition, we've also gotten a product called Artifact, which we've rebranded as Interact, that really enables physician engagement and really streamlines the query workflow between CDI nurses and physicians. We all know in healthcare, streamlining of user experiences and workflows is critical, so we think we've really achieved that as well, as evidenced by, we've gotten best in class for our Aware CDI suite 2 years in a row, and that's testament to our customers actually recognizing the value of the kind of value capture our products are able to offer to them. Fueled by that success, we've actually also entered another area of the mid-revenue cycle, which is primarily in the areas of medical necessity and utilization management. From our vantage point, we view utilization management and CDI as just two different sides of the same coin. CDI nurses are interested in ensuring that documentation is up to date so that quality reimbursement and denials is taken care of. So if I had to describe Aware to you in a nutshell, I would basically say it's like having a clinical assistant or maybe 10 clinical assistants to help your utilization management nurses. We basically review all the cases and prioritize the highest priority cases that your nurses should focus on. We really help them with patient statusing. And the most important element is that we also provide curated clinical summaries right at their fingertip for them to make a decision, which ultimately again results in having the most accurate, complete picture in the patient record, and definitely ensures that downstream you're preventing denials.
Yeah, that's great. Well, thank you so much for talking with me. It's been a real pleasure getting to.
Well, thank you for having me. I really appreciate it.